Good day once again, everyone. I'm Agnes Erzse. I'm a researcher at Priceless South Africa, and I will be presenting the study using the behavior change wheel to identify tailored interventions to improve food environments in public primary schools in urban South Africa. I'm presenting today on behalf of my research team. And over the next 10 minutes, I will not only present the identified interventions, but I will also emphasize the invaluable process through which we have identified these interventions. Our population of interest within the school food environment theme is children and adolescents. And this is a key period to establish healthy behaviors, including dietary behaviors. Schools play a significant role in supporting learners' health and development, but unfortunately, school food environments in South Africa are known to be obesogenic. Students have easy access to cheap and unhealthy food products, both within and outside of school. And it is in this context that in South Africa, over 13% of school-going children are obese. But interventions can be effective on condition that they are responsive and evidence-based. So the aim of our study was to identify context-specific interventions to improve primary school food environments in Gauteng, South Africa. And in doing so, we have leveraged behavior change models because we believe that the evidence indicated that interventions that are underpinned by theoretically driven behavior change models are more successful and lead to longer lasting changes. So the particular behavior change model we chose was developed by Michi and colleagues, and the model is called the COMBI, and it's embedded in a framework, the behavior change wheel. COMBI stands for Capability, Motivation, Opportunity, and Behavior. And the promise of the model is that for any behavior to happen, the individual or the population must have the capability, motivation, and opportunity to perform it. And by targeting and influencing the COMBI model's three components, policies can facilitate the behavior change. And the behavior change wheel is also made up of intervention functions. In other words, means through which a behavior can be tackled, like incentivization, and 7 policy categories. One is is legislation. The functions can target the sources of behaviors, and the policy categories can target the different functions. Here is an example. So, to eat healthy food in school, a student must know what healthy food is, capability, desire to eat healthy food, motivation, and the student must have affordable healthy food in a tuck shop available. This is opportunity. So ultimately, what the framework does is it helps us ask and answer 2 questions. 1, what needs to change, and 2, how to change this. In this study, we developed 2 objectives that is related to these 2 questions. Objective 1 was to identify risk factors influencing school food and beverage environments, and objective 2 was to identify responsive interventions. We followed a multi-stage process to identify interventions that are relevant to our context, and our context was primary schools in Gauteng province in South Africa. For objective 1, we've done a qualitative secondary analysis of interviews with school staff, 25 semi-structured interviews with school principals and tuck shop managers. And we analyzed the data thematically using the COMBI model. And for objective 2, we've conducted intervention mapping. And to identify evidence-based interventions, we used a nourishing framework and applied intervention functions and COMBI domains to the particular risk factors we identified in objective 1. So to respond to our first question, what needs to change? here is a simplified and shortened list of risk factors that was believed to influence school food environments. So first, students, staff, and also food providers had limited awareness of the various guidelines of school food and beverage guidelines. And they also lacked knowledge of the harms of unhealthy diets. And this was seen as a problem within their capability. Secondly, when it comes to opportunity, there were issues within the physical environment. So, for example, cheap unhealthy foods were sold both within and outside of the school premises. Furthermore, social environment was perceived to be a barrier due to the existing brand recognition, the social identity that is linked to unhealthy foods and products such as Coca-Cola, and also the reward culture that is built up around unhealthy foods. Issues with the infrastructure was also limiting the opportunity to improve the school food environments. This included lack of taps for drinking water, lack of eating spaces for children to have lunch, as well as lack of fridges to keep the fruits and vegetables and yogurt, for example, fresh, and there was also a lack of school gardens. Also, issues included organizational culture, such as the lack of monitoring and evaluation systems that were in place at schools, for example, monitoring of lunch tins by staff or official health inspections. And when it comes to motivation, profit motives characterized the food vendors as well as the school staff when it came to foods. And the profit was linked to the sale of unhealthy foods, unfortunately. And motivation also included the preference for unhealthy foods. To address these risk factors, we wanted to use interventions that are evidence-based. And for this, we used the Nourishing Framework, which provides 10 areas where governments need to take action to promote healthy diets and reduce obesity. And we reviewed this list and only included relevant interventions. So, for example, we excluded the health sector related interventions. Secondly, we identified the intervention functions, the means by which an intervention can change behavior. Then we identified the combi that the interventions spoke to. And then we matched the intervention to a risk factor, and we identified 21 interventions that we included in our study. One of these 21 interventions is to regulate what kinds of foods can be sold at school tuck shops using restrictions decided by the Department of Basic Education or school governing bodies. And this intervention was linked to the risk factor of cheap and unhealthy foods and beverages at tuck shops, and it represented an opportunity in the combi model. The evidence-based interventions that our context-specific interventions was linked to and was based on is the Nourishing Framework's intervention mandatory standards for food available in schools, including restrictions on unhealthy foods. And the intervention function was restriction. So we have 20 more of these interventions. But because of limited time, I only showed this example. But in the discussion, I'm happy to go over a couple of more. In conclusion, we believe that facilitators and barriers to healthy school food environments need better understanding to identify context-specific interventions that modify school food environments. And having the capability, motivation, and opportunity to make healthier food choices in schools is critical. Interventions are needed across various sectors. And we also think that the behavior change wheel and the combi model are helpful tools in identifying and designing interventions to improve school food and nutrition environment. I would like to thank for your attention. and also my research team at Priceless and the broader research group, GDAR, Global Diet and Activity Research Group and Network. Thank you very much.